Good afternoon, students. My name is Megan Molina, and I'm going to be talking to you today about trauma services and injury prevention. Before we get started, just a reminder, this is a live segment where you'll have the opportunity to ask questions. I will answer questions after I share a little bit about myself and what I do here. And so if you'd like to submit questions, you can do that by scanning the QR code on screen, or you can go to www.menti, which is MENTI.com, and the access code is 53820568. So again, you can either scan the QR code on your screen, or you can go to www.menti.com and use the access code 53820568. And then we'll get to your questions in just a little bit. So like I said, my name is Megan. I'm with Trauma Services. More specifically, I'm with Injury Prevention. I was born in Georgia and grew up actually in Venezuela and Mexico, but the Valley is home. I've been here since I was a senior in high school. Moved here when I was about to turn 17, turning 18. I went to school here in the Valley, and so this is home for me. I've been a nurse for over 6 years now. 3 of those were in the ER, and 3 of those were doing trauma ER specifically. And I've now been in this role doing injury prevention for about a month. So something fairly new for me, but trauma I've been doing for a while now. I always knew I wanted to be a nurse since I was younger. Growing up overseas, my family and I, we worked with a lot of communities that needed help in different ways, education and just different areas. And I loved helping people. I loved working with people, very outgoing person. And so I just knew that nursing was a natural choice for me because I really liked helping people. And that's why I chose nursing. When I first wanted to become a nurse, I thought I wanted to take care of labor and delivery. So those are the mothers who are going to give birth. And I thought, this is for me. That's what I wanted to do. But the beautiful thing about nursing is there's so many areas. And when I was in school, I did a rotation, which are basically classes at the hospital, clinicals. And I did my rotation in labor and delivery and found out it was not for me. And so the nice thing is I then had the chance to go to the ER, loved it, and I thought, this is the area that I want to work in. And so if nursing is something you're considering, it's something to keep in mind is you might think you want to work in one area, but once you're in school and you get to experience different areas of the hospital or maybe even outside the hospital, you'll then find an area that you like if nursing is for you. And so to become a nurse, it took me about a year of taking my prerequisites. Those are classes that you have to take before you can even apply to any nursing program. And those are general classes, sciences, anatomy, physiology, English, algebra. And then based on your grades in those classes, you then apply for a nursing program. I chose to go to STC because it was a 2-year program. And I liked that after 2 years, I would be able to start working as a nurse, as opposed to Pan Am, which is a little bit longer. And so that's why I chose that school. And so after I actually got accepted into the program, it's 2 years long, and those 2 years, they're hard. I would say that's the hardest part of all of my education were those 2 years getting my associate's degree, becoming a registered nurse. You have classes that are in the actual school themselves, talking about theory, learning the concepts, and then you're in the hospital. Like I said, you're in the clinicals, and that's where you kind of get to apply what you learned in the classroom setting. You're then applying it in the hospital, and you're learning along outside other nurses, and so it's really cool to see how the classroom then translate into hands-on. After that, I started working. I actually worked here at DHR as an ER nurse for 3 years. During that time, I decided to get my bachelor's. That took me about 2 years just because I took only about 1 or 2 classes at a time. I was paying for school by myself, and I was working full-time, and so I just took 1 class at a time. I did what was doable for me. It took me a little bit longer than some people, but that's how I was able to do it. I was able to pay for it. It was just 1 class at a time and kind of go from there. So after I'd been here about 3 years, I got the opportunity to apply for a program in San Antonio, and it was called the Trauma Nurse Fellowship. And that fellowship was about 6 months long, and I got to take care of the trauma patient in their whole rotation. So I got to go out with EMTs and pick up patients in the field. I got to fly with AirLife in the helicopter, picking up patients from scene. from car accidents or different things like that. I got to take care of patients in the actual ER that were trauma. I did administration, OR. It was a great opportunity. I learned so much. I grew, and I ended up staying at that hospital in San Antonio, which was a level 1 trauma center, which is the highest level, for 3 years. And now I've just come back home. Now I'm doing injury prevention, and injury prevention is trying to prevent the trauma before it happens. And so what I do is I go out to the community and address those highest mechanisms. So for the Valley, our number 1 trauma is falls. Which of course is mainly by our older adults. And so we have a program called Bingo Size, where I go to the community with older adults and we play bingo, but we also exercise. And so it helps them increase their strength and their balance. And so these things are hopefully to prevent them having a fall, and it's preventing trauma. We also do, for example, ATV safety. An ATV is a all-terrain vehicle, so like a 4-wheeler, a dirt bike, probably some things that you guys use on your time at home or maybe at the ranch. Since COVID, we've seen an increase in these accidents, probably because people are home and they're not working or at school, and so we've had a lot more accidents like that coming into the ER. And so if you are driving those vehicles, be careful. You need to wear a helmet. Do not drive them on pavement. They're meant to be off terrain, so on dirt roads, things like that, but not on the main road. Making sure that you're wearing long sleeves, long pants. If you were to fall off of a dirt bike or a 4-wheeler, you're going to come into the ER, and we see it all the time with lots of scrapes and cuts, and what we have to do is clean those out so you don't get an infection. It's very painful, so you want to avoid that happening to you. Make sure that if you are riding a 4-wheeler, if it's only for 2 people, only have 2 people on that vehicle. If you have more people, it's dangerous. Another program we have is Stop the Bleed. So if someone were to get hurt, we go to the community and we teach them what to do, how to stop that bleed. And I'm not going to go into depth of the class, it's an hour long, but just a couple things for you guys to know now are the ABCs of bleeding. So A, which is to alert, call 911, get help. If you're home, let your parents know. And tell someone, hey, call 911 right now. That's your very first step. B is bleeding, and you want to identify where the bleeding is coming from. And C is compress. Just put pressure. Whatever you have. You can put gauze, you can put a t-shirt, you can put a towel. Whatever you have, you're going to put that over the wound, and you're going to hold pressure with both hands. You're not going to stop holding pressure until the ambulance gets there. Okay, so that's just a little bit of prevention for you guys to know that you might need in your everyday life. What does a day look like for me? Every day is a little different. Mostly I'm out in the community. I come into work. I work in an office setting right now with injury prevention, and I see what I'm going to do for the day. Am I going to go give a class for Bingo Size? Am I going to go teach a Stop the Bleed? A couple weeks ago, we went to the airport, and we taught their staff about what to do if someone were to get injured, how to put a tourniquet on, how to put pressure. And so every day is a little bit different. Our team is big. We have nurses. We work with doctors. We work with the ER staff. We work with the community, with law enforcement. So it's a lot of people on the team. Some things to think about if you're thinking about nursing. Sometimes people ask some tips that, what you can do to start working towards that. Just now in your classes, the big things I would say is become strong readers and strong writers. A nursing school is a lot of reading and a lot of taking notes. And so even now in middle school, you can start developing those skills. Really be intentional about reading and finding what's important, taking notes, becoming a strong writer. All those things are going to translate later on when you take your college courses, as well as sciences. It is a lot of sciences for your prereqs, those classes that you have to take before you even apply for the program. You have to take anatomy and physiology and 1 and 2. You have to take microbiology. And so if you can really just focus on your science classes right now, some of that's going to translate later on as well. So don't think that what you're doing right now doesn't matter. It does. It's going to help you be prepared when you get to college. And if you were to make the decision for nursing, those are kind of some things that you can focus on. Okay, let's see if we have any questions. Nope, not yet. Oh, yes. When did you know you wanted to go into the medical field? Like I said, I knew since I was very young. There was a small time that I wanted to be a vet, but that was still in the medical vein. Then I went back to people. I always wanted to be a nurse. I was very interested just by the medical field and everything it had to do with it, especially ER. It's different every day. You go in, you don't know what you're going to get. Maybe you're going to take care of a few patients, but you might have a lot of patients that come in, all for different things. It's a very strong team environment. You have to work together in order to take care of those patients, and so I love that environment. How do you deal with bad news for patients? It's hard. I think especially in the ER, sometimes that is definitely a reality, and you just have to remember that this is their worst day and you have to be there for them. Sometimes you kind of have to take your emotions out of it a little bit. You want to feel, you want to know the pain they're feeling, but you have to also be there for them. You need to be strong for them. It's hard. It doesn't ever get easy, and you don't want it to get easy because that means that you're human and that you have compassion and you care for those people. What is my schedule like? So right now with injury prevention, I have it's an office job. So it's Monday through Friday, going at 8 o'clock in the morning and get out about 5. Sometimes we have events on the weekends, like this weekend. We're going to be helping with doing car seat checks, making sure that car seats are installed properly so that if someone were to be in a car accident and there's a child in the car, want to make sure they're well protected. That's also part of injury prevention. When I worked in the ER, it was a 12-hour day. So I would go in at 6:45 a.m. And I would work 12 hours and leave about 7 o'clock, 7:30 at night. And that was usually working about 3 days a week. Also something to think about that I didn't think about when I was younger and when I was becoming a nurse is people get hurt all the time, even on holidays, even on weekends. And so you have to also think about that as part of your schedule is you will have to work, if you choose to work maybe in a hospital setting like I did in the ER, you will work weekends, you will have to work holidays. What's the part of my job that I like the best? With what I'm doing right now in injury prevention, I like being in the community. I love meeting people, talking to them, sharing my knowledge with them. I think that my time as a trauma nurse for the last 3 years really helped what I'm doing now because I've seen a lot of trauma. And so it's easier to educate because I've seen it firsthand. And so I love talking to people, sharing knowledge I have, and then also hearing from them about their life experiences and things that they're going through. How do you deal with stress and loss? I think you depend on each other as a team, especially in the ER. Nobody else has gone through it except for those who are right there with you. You can come home and you can tell your family about it, but they don't know how it feels because they weren't there with you. And so you become very close with your team, and that's your support system. They know what it feels like to lose someone. They know what it feels like to be stressed. And so that's kind of like our therapy is just spending time with each other even outside of work. How do you know if it's for you? I think I knew since I was younger, but I think some advice I could give to you would be if you have any family members or maybe family friends that are in the medical profession, whether it be nursing or nursing tech or a doctor or a respiratory therapist, all these things, ask them about their job. Ask them what they do. Ask them if they like it, what parts they like, what parts they don't like. So you can kind of get a better sense of what the job is. I did have classmates that went to school with me that after a period of time they became nurses and it wasn't for them and they didn't like it. And so I think to kind of avoid that, just talk to people who are actually doing it and kind of hear their perspective. Oops, let me turn my phone off here. What college did I go to? So like I mentioned, I was at STC first. That's where I got my associate's degree. That was 2 years. And then afterwards, I did my bachelor's. It was at UT Arlington. It was completely online, so that was very convenient for me because I was able to work full-time and just take one class at a time. Someone's asking what my GPA was. My GPA, I don't remember what it was exactly when I applied for nursing school, but I do know that I had almost A's in all the classes because in order to get into nursing school, it is very competitive. And so those classes that you take before you apply, that's what they look at for who gets in. And so you do need to really try and do your best and do well on those classes because that's what they look at least for STC. I'm not sure what UTRGV's process is. I'm sure it's probably similar. So those classes, that's what they're looking at. So I know I had classmates who had to retake classes to get better grades in order to get into their program. What was the first time you treated a patient and what was it like? I don't remember the very first time I treated a patient. In nursing school, like I said, you're at the hospital, you're doing clinicals, and so you're in different areas. You might be like on a surgical floor or a medicine floor. I do remember my first rotation in the ER. I was supposed to be in the labor delivery floor, but there wasn't much going on, and so I got to go down to the ER, and I got to start my first IV. I loved it because it was very hands-on. And I just really liked that environment. It was very fast-paced. It was, like I said, a lot of teamwork. You're not just working with nurses, but you're also working with your techs, your respiratory therapist, the doctors. You have to have good communication because there's a lot of people that are involved with the process. What's the most common things you do at your job? So in the ER, of course, it's taking care of those patients who come in who've had some kind of trauma. Also in the main ER, you're taking care of medical emergencies. So maybe someone who has had a heart attack or a stroke. People come to the ER for different things. And so when the first patient first comes in and we start an assessment, we check them out from head to toe to see if they have injuries, and then kind of go from there. Do they need a CT scan? Do they need blood drawn? Do we need to give them medication? And we go from there. Can you describe a difficult emergency case and how you handled it? When I was in San Antonio, we had a very difficult situation where a family was in a car accident. Aunt was driving. She had her 2 children, and she also had her nephew with her. And none of the children were wearing seatbelts, and they were not in car seats. And her nephew was thrown from the vehicle and killed. And she was my patient, and we had to go to her. She kept asking about that child. We had to go to her and tell her what happened. Her life changed that day. Her family's life changed that day. And it was very difficult. Again, you have to just put the patient first and be as comforting as you can. There's really not much you can say in that situation that's going to make things better. And so we just try and focus on what we can, which is helping with pain, making them as comfortable as we can, and communicating with them. Especially with COVID, it's been difficult because we didn't allow family members to be with the patients. And so in situations like that, it's difficult because you've just gotten this horrible news and you're by yourself. You can't have somebody else back there with you to comfort you. And so that's been a whole nother component of nursing is trying to be that person's family member because you may be the only person that they have at that time. Let's see here. What inspired you to become a trauma-certified registered nurse? So the difference between being a registered nurse or a Bachelor of Science, a BSN, and a certified nurse is you take a national exam. So I am trauma-certified. It's an exam. I believe you have to have at least 2 years of experience in the area that you want to become certified. So you can be certified in trauma. You could be certified in emergency medicine, or emergency nursing, critical care nursing, and then it's an exam that you have to sit for, a national exam and pass. And then you have to actually continue taking education classes throughout the year to maintain that certification. What drew me to trauma specifically when I was in the ER, I just really enjoyed taking care of those patients. I liked seeing that something was broken and that we could fix it. It was a little bit more concrete than maybe medicine. And again, the difference between trauma and medicine, trauma is a force that happens to the body. So for example, in a fall, it's the body hitting the ground or hitting furniture. ATV crash, the body hitting maybe the ground when they're thrown from it or another vehicle. Whereas medicine is something that's more internal, might be a heart issue, might be diabetes. It's something that's more internal that's happening. And so trauma just always fascinated me, and that's what drew me towards that. How do you get along with coworkers? Good. Of course, I'm not going to say that everything's always perfect. I think that the ER especially draws a lot of personalities and everybody has different opinions and thoughts. But when you're working together for the patient, that's all that matters. The patient is the center, and we're doing everything we can to help that person. And so we work together, and so it's an awesome environment, and I get along really well with my coworkers. Have you ever made a mistake or gave a misdiagnosis, and what did you do to fix it? I think that I've never given like a wrong medication or anything like that. I have seen a provider, not at this hospital, come in and give the wrong patient a diagnosis. Like, for example, two gentlemen with similar mechanisms, like both were in a car crash and both were in rooms next to each other, and he went in and told one patient that, for example, he had a contusion on his lung, but it was actually the patient that was next to him. With something like that, once we realize that there's been a mistake, honesty. Just go in and explain what happened and apologize. Of course, those are not the kind of situations that we want to happen, but we are humans and errors do happen. But I think the best policy is to be honest, and in that case, nobody was hurt, so thank goodness. Some advice that I would give my younger self at the start of my career, I think, is don't be scared. I graduated high school and went straight into the program. I was the youngest in my class. My time in the ER for about 2 years, I was the youngest in the unit. And so sometimes I just felt like I didn't know if I was capable of doing all the things I needed to do. Was I mature enough to handle some of these situations that were difficult with people losing family members, losing children, losing parents? But I think self-talk is powerful. I just told myself, I can do this, just keep going. And that really helped me get through a lot. It still does. I'm sure, you can kind of do that in your own schooling too. You get nervous about something and you just tell yourself, I've got this, just keep going. Fake it till you make it, or just keep going until you are doing it. That's helped me so much. What do you think? What do you think is the most important trait that a person needs to succeed? I think determination. That's the biggest thing, and hardworking. I grew up with two siblings who were very smart. School was very easy for them. It was not for me. Nursing school, I had no life. I studied every day. I'd get up at 6 o'clock, get to the school when it opened, and studied for 2-3 hours before class started. I'd have class, I'd go to the library, and I would study until it closed. I'd come home, review my notes one more time, and go to sleep. And I did that every single day. Sunday was the only day that I would take half the day to rest and recoup. And so I don't think that I became a nurse because I was very smart. I think it's because I worked hard. And so I think that's the most important thing. It doesn't matter if you think that you're not able or you're not smart enough. You are, if you can just work hard, just being determined. That's the biggest trait, I think, or has been true for me. Is there any types of Grey's Anatomy situation going on? Yes and no. I mean, I think some of the medical things are true from the show. Actually, when I was working in San Antonio, one of our residents who was graduating, he actually got hired to be a writer on the show. So they're hiring real doctors to write their storylines, but some of the drama and all that is definitely exaggerated. There's one scene I remember where they have 3 doctors walking one patient in the hallway. 3 doctors would never walk one patient in the hallway. It would be physical therapy, occupational therapy, nursing maybe. So some of it's definitely not true, but some of the medical storylines are true. So yeah. Let's see here if there's any other questions. Are some days hard for you? Yes, definitely. Some days are hard. Some days you do question, why am I doing this? But then you remember why you started, which was to help people, and that's your motivation and that's your focus, and it pushes you through those days that are hard. And like I said, also having a good, strong team, that also makes those hard days more doable because you've gone through it together. And so you can talk about it, you debrief afterwards, and you just come back the next day thinking that hopefully tomorrow is going to be a better day. And there are things that are exciting and good, especially if you work in certain areas of the hospital. I'm sure labor and delivery there's a lot of joy because babies are born and people get better. But in the ER, I would say that most of the people that are there, that wasn't their plan to come to the ER that day. So most of the people that we encounter, they're in hard situations, and so it makes for hard days. That's for sure. if we have any more questions. How old were you when you started? So I was, as a senior, I took some dual enrollment classes. And so I got some of my prerequisite classes done before I graduated high school. And so I was 17, 18 when I started taking those classes. And I was 21 when I became an actual nurse. Turned 21 in November and became a nurse in January. So I think that's all for today. If you have any questions, you can always contact us. If you call the DHR line, the operator, you ask for trauma services. I'm in trauma services with injury prevention and outreach. My name is Megan Molina. If you have questions about anything, schooling, nursing, anything at all, I would love to talk to you all, and you can contact me at any time. And thank you.